Here's another question that seems to be coming up. How is the Inflation Reduction Act affecting Medicare in 2025 and beyond?
Sure. How much time do you have? This can go on for a while. So let's focus on what I guess was kind of already happened and what's coming up for 2025. So, so far on the drug plan or the drug coverage side of things, we've seen some changes over the last couple of years that are already implemented. So number one is there's a cap on insulin costs. $35 every month is the most someone will pay for a covered insulin. Drug price negotiations began last year. So they came out with the first 10 drugs ever to be negotiated by Medicare. The negotiated rates came out last month. They were pretty substantial. And the next 15 medications, that list is due to CMS by January or February, I believe, of next year. So this drug price negotiation thing is totally new. Medicare's never been allowed to negotiate drug prices. See that as probably a long-term positive considering the amount that Americans pay for prescriptions here, which is quite often quite a bit more than other developed countries, and hopefully saves the program some money over time. The big thing people are talking about for 2025 is the $2,000 max out of pocket. So once again, something that Medicare has never had is a max out of pocket on drug spending. And so next year for anybody who has, if their drugs, caveat this, if their drugs are on the plan formulary, then they will spend no more than $2,000 the entire year on all those medications. And that's a great thing for some people. I will say, the impact is certainly to be determined, right? Because what we also have, read and heard, depending on the data, is, it's maybe 5 to 8% of people were paying more than $2,000 prior to this year. And so while that's great for them, and we never want to see anybody have to make a decision, life or death decision on, getting the treatment and the medications they need, the reality is most people were not spending that much. So then what have we seen as the impact of this going into next year? Well, we're seeing plan consolidation. So there are just less plans, less companies want to really pursue, especially standalone Part D coverage. And number two is an increase in premiums. So we're definitely seeing, now some plans have come down or stayed the same on the premium, but generally speaking, we've seen an increase in Medicare Part D premiums, especially for those standalone Part D plans, which, a lot of your clients are going to have with a Medicare supplement. So we're seeing those costs go up. But at the end of the day, obviously, we're hopeful that it does keep, costs down for the Medicare program, save taxpayers money, and then, of course, their individual drug costs out of pocket. It would be great if most people could benefit from that.
Now, what specifically is changing with Part D coverage in 2025?
Yeah, so the big thing does go back to the max out of pocket. Certain things about Medicare Part D have remained consistent. For instance, there are 6 protected drug classes where basically almost all drugs have to be covered. We won't go through the individual classes, but that's remained intact. And then every other plan or every other therapeutic category has to have at least 2 drugs covered, right? So these are things that have remained in place in terms of the actual coverage itself. What we are seeing with the change in the max out of pocket is, perhaps a shift in where those drugs are covered on the plan formulary. So not to get too deep in the weeds here, but you have typically tiers 1 through 5, preferred through brand through preferred generic through specialty, and so maybe there's a shift. Some of those drugs go into a higher tier, which may ultimately cost that beneficiary more money out of their pocket, albeit up to their max out of pocket. Now, one thing that is important to note in 2025 and moving on is that there are 2 types of drug plans. And so this has been kind of hard to understand for people, and we're explaining a lot of, every day now during annual enrollment, where you have an enhanced plan option and a basic plan option. And basically, the main thing to note about those 2 things, on a basic plan, which is probably going to be your lower cost plan with a $590 deductible, is if you spend $2,000 out of pocket, if you reach that cap, that is $2,000 truly out of Jordan's pocket, right? On the enhanced plans, you're probably paying a significantly higher premium, maybe lower to no deductible, and you might actually hit that $2,000 max out of pocket, and you perhaps have only spent $400 or $500. So how's that possible? These enhanced plans have third-party payments from insurance companies and pharmaceutical manufacturers that actually contribute to your max out of pocket. So where you may have gotten by with a lower cost plan previously and could never imagine paying, $90, let's say, for a drug plan, you may find that it's worth it because all of a sudden these expensive drugs you're on are being subsidized, in part by a third-party payer, and you're actually only paying a few $100 out of your pocket for the year. So that's a real big difference as it pertains to this legislation going into next year.